Hello from Edmonton, Treaty 6. My name is Timothy Caulfield, and I'm a Canada Research Chair in Health Law and Policy at the University of Alberta. And I have spent decades studying misinformation, and holy cow, are we ever in it now. In fact, we're right in the middle of what's been called an infodemic, and we know this is causing great harm in stressing people out. In fact, this term, the infodemic, came from the World Health Organization over a year ago, and they were very right to categorize what's going on right now as an infodemic. And not only do entities like the World Health Organization, the CDC, the Public Health Agency of Canada, our provincial governments, our federal government recognize that this is a problem, Canadians recognize it too. This was a study that came out not that long ago, I'm going to say February. StatCan found that 96% of Canadians recognize that they're seeing misinformation kind of on the daily. And that's a remarkable number. And by the way, that same study found that over 90% of people are getting their information online, right? So there's a lot of misinformation out there. And of course, I'm talking about largely misinformation about the pandemic right now that we know has done great harm. What kind of misinformation is out there? Well, we're hearing misinformation about the source of the pandemic. That's been around for a long time. This is one of my favorite examples, that 5G technology caused the pandemic. I don't know if you guys knew this, but Woody Harrelson on social media kind of was the epicenter of the 5G controversy. But we've gone from 5G to drinking pee. There are all these suggestions about what you need to do to cure the pandemic. And again, this has done real harm. This is something that we're studying at the Institute. And by the way, don't drink your pee. Actually, urine has had a very big year. People are drinking cow urine. They're drinking the dog urine, and they're drinking their own urine. No, don't do that. But we know this is causing real harm. And where is the social media coming? Where is the problem coming from? Well, this is largely, not entirely, but largely a social media phenomenon. There's been a growing body of evidence to suggest this. There's an interesting study from last summer from McGill that found that, if you get your information from a social media platform, you are more likely to believe misinformation, more likely to spread misinformation, right? And there's been other studies since then that have replicated that finding. And we also know that this is stressing people out. This is stressing people out. And that may in turn cause people to spread misinformation. So what kind of harm? What's the harm of all this? Well, you guys know the harm. There's been deaths, right? There's been hospitalizations. There has been increased stigma and discrimination as a result of misinformation. There's been property damage. There has also been skewed health and science policy. The hydroxychloroquine debacle is just one example. It's also just added to our chaotic information environment. And we know that does great harm also. Of course, though, it's also causing a great deal of harm in the context of vaccine acceptance. We're misinformation about the idea that it will cause infertility. No, it won't. That the vaccines will change your DNA. No, they won't. That the vaccine will cause you to shed viruses. No, they won't. But we know that this kind of misinformation, there's a good body of evidence to back this up, has an impact on vaccination uptake. It does real, measurable harm. Okay, so what are we going to do about it? How are we going to respond? What is the answer? Well, you've already heard from my wonderful colleagues about some of the things that we need to do. This is such a complex problem. We need to come at it from absolutely every direction. I actually think we need the regulators to do more. And by that, I mean Health Canada, the FDA, the FTC. We need the provincial regulators to do more. We need the College of Physicians and Surgeons to do more, monitor their members. So we do need to do more. But in addition to that, we need evidence-based strategies for the social media platforms. And in addition to that, we got to get out there and we've got to debunk. Debunking does work. We've got to flood the social media platforms with good, reliable content. It really does work. Debunking works. So what does that mean? That means listening first. What are people worried about? And then providing, let's get that right, providing good science, highlight the gaps in the logic, be nice, use engaging content, Creativity wins. We got to use art. We got to use humor. We have to use narratives and aim for the general public. Don't waste your time on those hardcore deniers. We've tried to do that with our own initiative. It's called Science Up First. This is a social media project, an initiative aimed at Twitter, Facebook, Instagram, TikTok. Join the conversation. Join Science Up First. Get out there, shed the good content. I hope you become part of the team. Thank you very much.